Hello, my name is Ashley Fisher, and today I'm doing my PowerPoint on proper ostomy healthcare. What is an ostomy? An ostomy is surgery to create an opening from an area inside the body to the outside using the intestine. This new opening is called a stoma. With an ostomy, there must be a new way for waste to leave the body. It treats certain diseases of the digestive or urinary systems. It can be permanent when an organ must be removed. It can be temporary when the organ needs time to heal. The organ could be the small intestine, colon, rectum, or bladder. What causes an ostomy? There are many different types of ostomies and many causes as to why they are needed. Some common causes for ostomies are inflammatory bowel diseases such as ulcerative colitis, Crohn's disease, and diverticulitis. Another common cause for ostomies is cancer. It can be rectal cancer, colon cancer, or bladder cancer. It also could be caused due to blockage causing a bowel perforation. Also, trauma can cause an ostomy, such as blunt force to the abdomen. Common types of ostomies are colostomy, ileostomy, and urostomy. A colostomy is where the colon is attached to the stoma and bypasses the rectum or the anus. There's different types of colostomies depending on which part of the large intestines is used. An ascending colostomy is usually on the right side of the abdomen. A transverse colostomy is where the sigmoid and descending colon and part of the transverse colon are removed or disconnected. The stoma can be in the middle or on the right side or left side of the upper abdomen. Stool varies from a paste-like to almost liquid in this area. A descending colostomy is where the sigmoid and part of the descending colon are removed or disconnected. The stoma is usually on the left side of the abdomen. Stool may be almost firm. The sigmoid colostomy is where the last section of the colon is removed or disconnected. The stoma is usually on the lower left side of the abdomen, and in this area, the stool is most often firm. An ileostomy is where the bottom of the small intestine, the ileum, is attached to the stoma and bypasses the colon, rectum, and anus. Stool from your ileostomy will usually be liquid or pasty. A urostomy is where the tubes that carry urine to the bladder are attached to the stoma, and this bypasses the bladder, so urine can come out. Why is ostomy healthcare important? Approximately 450,000 people currently live with ostomies in the United States, and an additional 120,000 ostomy-related surgical procedures are performed annually. Postoperative complications occur in 71% of ileostomy patients and 43% of colostomy patients. It is important that the patient goes home with proper education on how to care for their stoma. Most complications have a simple solution, but with shorter hospital stays, there is less time to educate patients before and after surgery as to what to look out for. If discharged without proper education, it can lead to rehospitalization, unnecessary ER visits, and frustration for the patient and family. Often we see patients that are discharged too early. The hospitals are pushing people out faster than we can educate them. When discharged without home health and little to no education, many call their ostomy clinic with complications the following week post-discharge. They usually have situations such as appliance failure and skin breakdown. Mostly the skin breakdown is due to the constant appliance changes or leakage. When you only have a short amount of time to educate each patient, you need to prioritize your teaching to fit in as much important information as possible. You must set them up with the foundations they need to get back to living a normal life and prevent complications. Expected learner outcomes prior to discharge from the hospital will include measuring your stoma, how to properly empty your pouch, and how to properly apply an ostomy appliance. How do you measure your stoma? A. Circumferentially. B. Top to bottom and side to side. C. Diagonally. Or D. No need to measure your stoma. The correct answer is B. Top to bottom and side to side. Not all stomas are perfectly round. For example, if your stoma was in the shape of an oval, you would want to measure it top to bottom and side to side. This would ensure a proper fit to your ostomy appliance. Measuring it diagonal wouldn't work. And you must measure your stoma every time you change your appliance after surgery for at least the first 6 weeks. Stomas change in size due to edema. It's also important to then measure your stoma once a month for the first 6 months to ensure there is no changes in size. When do you empty your pouch? A half to a third full. B, a quarter full. C, 3/4 full. Or D, when it's completely full. The correct answer is A, when the pouch gets a half to a third full. About right here. If you let the pouch get too full, it can pop off or pull the wafer away from the skin, causing stool or urine to irritate the skin. How to empty your pouch. To empty your pouch, sit on the toilet and scoot your bottom all the way back. You also could stand in front of the toilet if that's more comfortable. Pull your clothes away from the pouch. Hold the bottom of the pouch up and undo the clip and set it aside. Slowly unroll the tail over the toilet. To use cuffing technique, this is where you roll the pouch up like you would roll socks together when folding them. Slide your fingers down the pouch to empty out the stool or urine. Then you can take a paper towel or washcloth and clean the rolled end of the pouch and roll it back down. This prevents stool or urine from getting on clothes and keeps the end of the pouch clean. Then you place the C-clip at the end with the curved part towards your body. Clip it and gently tug to make sure that it is secure. How often do you change your ostomy appliance? A. Every day. B. Every other day. C. Every 10 days. Or D. Every 5 to 7 days. How often do you change your appliance? The correct answer is D. Every 5 to 7 days. It can be helpful to use a calendar to be able to check off the last time you changed your appliance. That way you remember. You can also write the date on your wafer. If you're changing your appliance every day or every other day, there could be an error with the application process, and if it's leaking, you have an error with your appliance. You should not change it longer than 10 days because it can pop off or cause problems with skin irritation if it stays on too long. To change your ostomy appliance, it's usually good to change it in the morning before breakfast. This way, you're not as active to have stool come out. If you have a urostomy, it doesn't matter when you change it because you're constantly producing urine. I am now going to walk you through a proper ostomy appliance change. First, gather all your supplies that you need so everything is right next to you. You will need your wafer, your pouch, your clip at the end of the pouch, paste, which is optional, scissors, preferably curved scissors, your measuring guide, paper towels or washcloths, adhesive remover wipes, and a trash can close by. Sit in a comfortable position where you can see your ostomy. This could be in front of a mirror in your bathroom. Remove the wafer from your skin using an adhesive remover wipe gently, removing it away from your skin to avoid skin stripping. Remove clip from pouch before throwing it away, as this can be reused since only one clip comes with a box of appliances. Cleanse the skin around the stoma with a washcloth or paper towel. Clean the stoma off as well. Now take your measuring guide and measure your stoma from top to bottom and side to side to determine how to cut your wafer. You can trace the pattern onto the skin barrier so that you know the amount that you need to cut. Cut the wafer according to the size of the stoma, assuring not too much skin is showing and so that it is not too tight around the stoma. Using curved scissors works best so you're able to cut out the circle. You can place it over your stoma during the process to just make sure that it's the right fit. Now, remove the plastic backing off of the wafer. This is optional, but you can apply a thin layer of paste right around the opening of the wafer, just around the rim. Let the paste dry for 45 to 60 seconds as it has alcohol in it and it also needs to get tacky in order to adhere correctly. Place the wafer onto the skin, pressing down gently. Remove the paper backing strips once the wafer is applied. You hold the wafer to your skin for about 45 seconds to make sure that it fits properly. Snap the pouch on from the bottom to the top using a Tupperware-like seal. Going from the bottom up to the top protects the stool from leaking out if it starts coming out while attaching the pouch. Ensure it is snapped in all areas to prevent leakage. Place the clip curved side towards the body. Slightly tug on the pouch end to make sure the clip is secure. Put a date on your wafer so you know when it was last changed. The key points to take away from this presentation are understanding the different type of ostomies and which one you have, being able to prevent complications such as appliance failure, the pouch popping off, and then the basics, knowing how to measure your ostomy to make sure that your appliance fits properly, know how to empty your ostomy from stool or urine, and also how to do a proper appliance change to prevent skin stripping and appliance failure. You can leave the hospital with a basic foundation to build upon, understanding these key points. Here are the references for this presentation. Are there any questions?